The planet is more vulnerable now than ever before when catastrophe strikes. Can governments, the private sector and academia behave differently before, during and after a crisis to help us be more resilient in the face of disasters?
When we look at the impacts of disasters, they really affect across a wide range of civil society. So some of the most obvious are on what we call the built environment, all this stuff that we build around us, infrastructure, housing, places of work, things like that. You see that physical damage that's done there. At the same time, that has enormous disruption to the economies, right? If you have a workplace that people can't go to, then that person can't go to work. If they don't get paid, they can't buy stuff if they're not buying stuff. So it has these ripple effects across the economy. And then one of the other areas we look at sort of in this kind of built environment is this housing and where people live. We find that actually housing is one of these prerequisites for sort of getting economies up and running again. And it's one of the hardest things, especially when we're looking at affordable housing, when we're looking at people who might have less resources to be able to rebuild. And that brings in the social dynamics. And the social dynamics are less visible from the camera lens, but much, much more predictive in terms of how communities recover in the aftermath of a disaster. One of the terms we like to use is called capacity to cope. If you have a lot of connections, if you have a lot of resources, if you have a savings account, if you have a car where you can drive further distances to get things, you have more options. You have more of a capacity to cope with what's going on. And this is where we start to see extraordinary inequities in disaster preparedness and disaster impacts and disaster recovery, because we may all be impacted by the same hazard, by the same storm, by the same flood, by the same earthquake, but our ability to cope with that varies very widely based on pre-existing inequalities in our societies. To give some examples of these social inequalities and disasters, maybe I'll give one in the US and one internationally. So in the US, we were doing some work after Hurricane Harvey, a major tropical cyclone. We call them hurricanes that affected the Gulf Coast or along the Gulf portion of the southern portion of the United States. And one of the communities we worked with is this major tourism industry. And so what you saw is actually a lot of these houses that were beachfront homes right on the ocean had actually fared pretty well. They're owned by very wealthy people. They were built to higher standards. There were people who could afford to build their homes to higher standards. And some of them were destroyed. It was a very powerful storm, but a lot fewer than you might have thought just looking at it. Then you go about a couple of kilometers inland, and then you get into the areas where a lot of the service workers, the people who work at the restaurants, the hotels live. And there you see flooded out damage long after, and even in the recovery, you'll see a lot of the wealthier areas, the more visible areas recovering more quickly. But you go inland just a little bit and you find places that, maybe power's been restored to the street, but people can't afford that connection to connect their home back up, so they still don't have power, or they haven't been able to get contractors in because prices have been so high and they don't have money, and so they have mold in their homes. We heard stories of people in a tool shed who would put insulation in there because of how cold it was in winter, because there was too much mold in the house for them to sleep in. And so anytime there's a disaster situation, you'll see the very visible areas where there's a lot of tourism sort of recover very quickly. And if you just go behind the scenes to where are the people who serve the food, who take out the trash, who are necessary for that, really, really struggling for years and sometimes even decades after that event. Another example that I give, and when we talk about disasters, we think about acute disasters, very intense, very immediate, and then the long-lasting impacts. We also have these slow-moving sort of chronic disasters like drought and extreme heat. And then they have pressure on nation stability, on agriculture and things like that. One of these sort of chronic situations from instability, we were doing some work with Syrian refugees in the Middle East in the midst of the height of the Syrian civil war. And I was in Jordan, and I was talking to someone with the UN agency. We were speaking with UN, UNICEF, UNHCR, and we had all this data on high literacy rates among the Syrian population prior to the civil war, and we were getting mixed messages from different NGOs, different refugee groups, some saying that there's high rates of literacy, and others really in country saying, no, you have to develop things for an audience with very low levels of literacy. And so I asked this colleague at the UN, I said, what's up with that? Like, why does the data say one thing and people are telling me another? And he thought, and he said, Jeff, you come from an institute of higher education. You've got at least a master's degree, probably, right? And I said, yeah. Yeah. He said, you have contacts around the world, maybe not deep contacts, but you got some phone numbers on your phone. I said, yeah. And he said, you might have some savings, maybe in retirement or a home or something like that that you could leverage. And I said, yeah, that's a good point. And he said, how long would you be in a refugee camp before you found your way out? And this really resonated with me because that is capacity to cope, is that when we do have these situations to sort of help those, that you increase this concentration of vulnerability, and it creates sort of this lifeline for essential services, but also a little bit of this like socially isolated sort of trap almost of sort of concentrating vulnerability in a way that makes it harder and harder to escape. I think if we're talking about disaster preparedness and sort of its most basic elements, I would sort of put it into three general categories. One is at the individual level and just sort of that basic preparedness. And so that really comes down to, I think, kind of two major things. One is in the disaster planning itself, you have to think along sort of two scenarios. One is either you're going to have to stay in one place for a long period of time, cut off from everything else, or you're going to have to leave very quickly and for a long time and possibly forever. And so when you're putting these things together to really think through, what do you need? What do you need to stay alive? Do you have medication? What do you need to be happy? What do you need to be healthy? And what do you need for those connections with other people to stay in contact? Is it the phone numbers? Do you have pre-existing plans on where you could go? And so these are very kind of tactical things. But the other is involvement, community involvement, because these social bonds are one of the most important predictors. Neighbors helping neighbors, what we call, a colleague of mine refers to as horizontal social capital. We look out for each other. And that actually is very measurable in terms of the health and the mental health benefits before, during, and after a disaster. Having what in the US we call them a block party, festivals, ways of engaging with each other. And then there's vertical capital, how connected you are to your local government and how connected that government is to the national government. Because when disaster resources flow in, they tend to flow in either directly or with a lot of guidance from political institutions. So going to those community meetings, being involved in civil society are also really, really important investments, at least as important as that own personal preparedness kit and things like that. And then for institutions, for governments, I would say that, we know time and time again the value of preparedness, how much cheaper it is to prepare versus respond, and how much that investment pays off. But we don't do it, right? We don't do it because the signals that we have tend to reward us more for a good response than for good preparedness. And this is something we really need to get ahead of. We can't out-respond to climate change. We can adapt. We can do a lot on the adaptation side. And I think we're behind, but there's a lot that we can do. And when we talk about the costs of disasters, which is often the measure, really what we're talking about is the impacts to lives and livelihoods, and those have much deeper impacts. My colleague Ellen Carlin and I, we wrote this book, Catastrophic Incentives: Why Our Approaches to Disasters Keep Falling Short. And we did this because we noticed that there's all this data that sort of tells us what we need to do. We actually started it during the COVID pandemic, during the early days, because everyone was saying, well, we couldn't have seen this coming. And we said, well, we actually helped write a lot of the reports that are predicting what's happening right now. There were a lot of government reports, there are a lot of international reports. And when we were tired of being mad, we decided, like, we need to understand this, right? This isn't just, people being jerks, right? There's something more deeply embedded here. What is it with our business models of how we run civil society? What is it with these incentive structures? And so I'll give an example. In the US, there's a very strong signal for voters for response. So if you bring in a lot of money for response, not only are you bringing money into your community, you're essentially buying votes, So you have a big incentive to see that. Preparedness spending, we know, can save anywhere from $1 to $6 to $1 to $15 for every dollar you spend in preparedness, what you save in response and recovery, depending on how the calculation's done and what study you're reading, but it's a lot. There's no signal among voter behavior. We don't recognize preparedness. Public health has had this challenge forever, right? How do you value something that didn't happen, right? It's and the further you get from it not happening, I think the value of public health was really, in the US, was really appreciated when things like yellow fever and smallpox were eradicated. And now it's, why are we spending all this money on this? This is all just to say that I think that, one of the biggest, there a couple of the, maybe I'll say 3 major challenges to this is, one is this underlying incentive structure is really sort of wired towards these quarterly earnings reports, shareholder expectations, donor expectations, et cetera, that are well-intentioned but not holistic. They're not necessarily based within, they might be based in the emotion of someone who's giving, which is well-intentioned, but not into the long-term interest of where that money can go the furthest. The other is that it's expensive. There is no way around it. Adaptation to climate change is more expensive, but it's even more expensive to rebuild every time that we get hit. And right now we're in a period where we're getting hit harder and we're behind on adaptation. So it's going to be double expensive. The longer we wait, the more expensive it gets. And you have to do this in a political environment that's increasingly polarized, that's also competing. We have large populations, we have affordable housing issues, we have transportation issues, we have pandemics, we have all these other competing demands. And somewhere amidst all of those competing demands, we're trying to make the case to say, spend more money on this, which essentially translates either into spend less money on that, or borrow more money to do this. And so we're still trying to crack the code on how do we reconcile all of these larger intersections. And so, but all that being said, I think that's the importance of a lot of the programs that we have emerging, including at the climate school and some of the programs that I know we'll talk about, because they're designed to sort of start thinking, or really, I shouldn't say start, I should say continue thinking, to add more effort towards coming up with those solutions, because that's how we break this cycle. That's how we get ahead of this. Coming this fall, the Climate School, we're launching 2 new degrees. So we have our flagship, our original degree, the 1-year Masters of Arts, MA in Climate and Society. And then we're also launching a 2-year MS in Climate and a 1-year, in partnership with the business school, an MS in Climate Finance. As that part of that 2-year program, students will either select a dual degree track or a certificate track. And one of those certificate tracks is in climate and disaster management. This is based on sort of a collection of electives and concentrations that have been built up through the MA in Climate and Society. And whether you do the MS or not, these courses are available as electives kind of throughout the programs. In terms of the students, what I really love about the climate and disaster management courses is, there are a lot of programs out there that are kind of focused on the emergency manager and the disaster manager and the crisis manager. It's sort of that career track, which is great. We need that. We need lots of that. But in my world too, you sort of have the disaster manager, but they're really a coordinator across all these other aspects of civil society. And what we really need, in addition to that sort of specialist, is we need competency in all these other areas of civil society. And one of the most exciting things, on the first day of class, I ask my students for my survey course, Climate and Disaster Management, why are you here? What is your background and why are you here? And some will be journalists or anthropologists, some will be more on the quantitative side, some will be in finance, some will be coming out of undergrad. So it's that cross-section of civil society and the different directions people go in. And the answer that they often give, maybe 2/3 or so, will say, I don't know exactly what I want to do with disaster management, but I can tell that it's really important. And perhaps maybe they have a personal story where they were affected, or someone they know was affected. That's perfect. That's great, because that basically, that's what we want. And some people who come through do go into careers in disaster management. Others go into finance, into NGOs, into government, with more of an understanding on what is the value of these investments in resilience? Who are the partners that we need to work with? What are the different value propositions when working with different sectors? And so really building those skills to not only understand the fundamentals of the impacts of disasters and speaking that through the lens of climate adaptation, but also the competencies to work with other people and other sectors and to understand those perspectives. And so we do it through a range, through the survey course that I mentioned that sort of goes through a lot of different aspects, like talking about different data sources, research methods, how we pay for disasters, how climate change is impacting disasters, sort of really going through each week sort of a different section, and then getting into more deep courses like economic and housing recovery and disasters, building community partnerships in disaster risk management, applied, how do we look at research methods in disaster? How do we understand the data? And if we're interested in designing research, design that research. And then we have different tracks, sort of a choose your own adventure, right? If you're interested in food systems, there are courses in food systems and supply chains and geospatial data. If you're looking to be more on sort of the technical side or really interested in the mapping. So it's really designed to help create competency and create expertise, not only among disaster professionals, but among the people who have a role in building resilience, which I would argue is just about everybody.